Circumcision. Should insurance pay? What we're about to discuss is the ethical dilemma of whether or not insurance should pay for a circumcision. What do you think? So what is a circumcision? Males are born with a hood of skin covering the head of the penis. In circumcision, the foreskin is surgically removed by a doctor, exposing the end of the penis. According to the CDC, approximately 80% of men are circumcised in the United States, and circumcision is one of the oldest surgical procedures performed worldwide. How's it done? Well, there are three major methods of circumcision. They're the Gomco clamp, the Plastibell device, and the Mogen clamp. As you can see on the right, these are images of each of the devices. It shows how they are placed on the penis and how the skin is cut from around the penis. This procedure typically takes about 15 to 30 minutes, and a numbing agent would be used. So why would you circumcise? How about for hygiene reasons? It's easier to keep the penis clean without the skin covering the head, although boys can be taught how to properly clean an uncircumcised penis. There's a decreased risk of UTIs and a decreased risk of HIV and penile cancer. Aren't those some pretty good reasons? What about religion? Judaism, Islam, and even some Christian religions perform religious rituals for circumcision. And then, of course, there's social and cultural reasons, so that the male newborn may look like other men in the family, or because it's what they think is normal. Why not circumcise? Of course, with any surgical procedure, there is a risk for bleeding and infection. Of course, there's pain. And what about the cost? It can range from hundreds to thousands of dollars if your insurance doesn't pay. It's ultimately the parent's decision to circumcise or not circumcise a male newborn. So why all the fuss in this ethical dilemma? Well, there's some people that argue that circumcision of male minors is not medically justifiable, and that it violates the principles of medical ethics, including non-maleficence, beneficence, justice, and preserving the child's future autonomy. Some people feel that circumcision should be delayed until the individual reaches an age of understanding so that they can make their own decision and weigh the risks and benefits. In an article in the Cambridge Journal of Law, Medical, and Ethics, published in 2016, writers defined circumcision as unethical and unlawful, citing the procedure as painful, non-therapeutic, and irreversible, posing a risk of physical injury, psychological issues, and even death. This article also cites the foreskin as being protective and moisturizing for the penis, and states that it plays a role in sexual response. These are the reasons why they think the foreskin should be left intact. The American Medical Association Journal of Ethics argues that non-therapeutic infant or child male circumcision, in the absence of a valid medical indication, is an unnecessary surgery that causes pain, permanently alters the penis, and needlessly exposes a healthy child to a risk of iatrogenic injury. Now, the stakeholders in this dilemma are the parents and, more specifically, the child. Of course, the child's going to be affected for life, whether or not circumcision is done or not done. Of course, the child could have it done later on in life if they chose, but then that brings us back to that ethical dilemma. Is insurance going to pay for it if it's considered elective? And of course, the parents are just trying to do what any good parent would do, make the best decision for their child. Now, I do understand the issue of autonomy to an extent, but don't we all as parents make health decisions for our minor children based on what we think is best for their health? As far as non-maleficence, yes, it is our duty to do no harm, but what if circumcision is saving the child from future harm? Now, since circumcision is referred to as an elective procedure, of course, it may not be covered by your health insurance policy. But is it really elective or cosmetic if the parent's decision is made as a prophylactic measure? So what about insurance? Let's break it down. 17 states do not provide Medicaid coverage for neonatal male circumcision. Despite American Academy of Pediatrics recommendations supporting access for families that choose it, circumcision is often considered cosmetic and may not be covered even by private health insurance if it's not for a medical reason. There's state-specific data that reveal trends in neonatal circumcision that is similar to previous national estimates. However, some states are showing a decrease due to defunding. Black neonates in particular appear to be disproportionately affected by changes in Medicaid coverage. Here's what the American Academy of Pediatrics has to say. After reviewing multiple studies on circumcision, the AAP reports that the health benefits of newborn male circumcision outweigh the risks. But at the current time, the scientific evidence is not strong enough for the AAP to recommend routine circumcision of all newborn boys. Instead, the American Academy of Pediatrics advises parents to learn the facts about circumcision and to weigh the pros and cons. In addition to considering the medical factors, religious and cultural beliefs, If any of these things are important to you, they deserve to be seriously considered when you're making decisions for your child's future. Approximately 55 to 65% of all newborn boys are circumcised in the U.S. each year. This rate varies by region, with western states having the lowest rates and north central region having the highest. This procedure is much more common in the U.S., Canada, Africa, and the Middle East than it is in Asia, South America, Central America, and most of Europe, where it's an uncommon procedure. So do you think the insurance should pay? While circumcision is an individual decision for the parents of a newborn male or for an adult male to make for himself, everyone has an opinion. I personally agree with circumcision and made that decision for my son based on research and the health aspects. I do somewhat understand why insurance would not pay as they deem it elective, but what about parents like myself that made this decision to protect our child from issues later on in life? There's support on both sides of the fence for and against circumcision and insurance paying or not paying. And with the procedure having been around for so many years and there's still not a definitive answer leaning one way or the other, it will likely continue to be an ethical issue. Circumcision. Should insurance pay? What we're about to discuss is the ethical dilemma of whether or not insurance should pay for a circumcision. What do you think? So what is a circumcision? Males are born with a hood of skin covering the head of the penis.